Welcome to the Care England Alsico podcast. I'm Richard Ayres, a social care advisor at Care England, and I'm joined today by Greg Holston, the Business Development Director at Alsico. So across the social care sector, we talk constantly about recruitment and retention and the pressures facing our workforce. But we often talk about these issues at quite a high level, and we don't always stop to ask the much simpler question around what actually makes the biggest difference to those lives of those working daily in adult social care who deliver care. Now, some really great research conducted by Alsico alongside Care England looked closely at that question and highlights some really important points that many of the things that improve staff wellbeing, retention and morale are really practical, achievable changes that organisations can implement today very simply. So we're going to be talking about the experiences of the workforce and what organisations can do in practical terms to better support the people who deliver care every day. They are our most valued asset and we need to really look after them. As I mentioned, Alsico recently published a series of reports and articles looking at the realities of working in care. And that was drawing on the research with care workers across the UK. The report explored a number of areas that don't always get the attention they deserve in workforce conversation, including things like physical comfort, injury prevention, emotional well-being, career development, menopause support, and the role that everyday factors such as workplace culture, communication, and even a care worker's uniform plays staff morale and recruitment and retention. So what's particularly interesting about the research is that while it highlights some of the challenges faced by the workforce, it also points to many opportunities for improvement that don't necessarily require major investment. And often it's about thoughtful, practical changes that can make a really significant, meaningful difference to the people's lives who are working in our care service on a day-to-day basis. So to explore the findings and what they mean in practice for care providers, as I mentioned earlier, I'm delighted to be joined by Greg from Alsico, who has been working closely on this report and has been really involved in the research and the wider conversation about how we can create more supportive and sustainable working environments for care professionals. So Greg, welcome to the podcast. Please, would you introduce yourself to those who are watching and listening today?
Yeah, thank you, Richard. So I'm Greg Holston, as Richard alluded to, Business Development Director here at Alsico. Been with the company now for 8 years and focused on the healthcare sector as a whole. Primarily, Alsico has supported the public sector, but it's had longevity to the private healthcare sector, and really that's a core focus for us going forwards. So this research piece was really key for what do we do next? How do we further support the sector going into the future?
And I know when we talk about the health sector, we mean health and social care, don't we? Health sector is a broad term for you.
Yeah.
So let's crack straight on with some questions that we've got for you, Greg. What, first of all, prompted Alsico to carry out this research into the experiences of the care workforce?
So the starting point for this research was really the conversations we were already having with care providers, frontline teams. The care sector has been a priority for a long time for Alsico. And through working closely with those organisations on their uniforms, as well as participating in sector events, we kept hearing about the pressures care workers are facing in their day-to-day roles. At the same time, we appreciate the wider sector's under a lot of strain, from funding pressures to workforce shortages. So we found it was important to step back, and we sat around the table, asked a simple question: what does a job actually feel like for the people delivering care every day? So from that, we managed to then undertake a survey. We got more than 400 care workers across the UK to participate. And it was really to understand better the physical working environment, the emotional well-being, and how supported those workers felt at work. Our aim wasn't just to highlight challenges, but to identify practical opportunities where small changes could make a real difference to the workforce.
That's really great that you see the care sector as a priority, because we do live in the shadows of the health sector and the NHS. So it's great that we're starting to look at social care on its own and the differences and the nuances that presents itself, because the work in social care is very different to health. And you rightly recognise the many pressures on the workforce, and it's great that you engage with over 400 care workers to really understand their views. And why was it important to focus on the everyday experience of care workers rather than just on organisation policy?
I appreciate a lot of existing research quite rightly focuses on policy, funding, structural issues across the sector, but those conversations can sometimes feel quite removed from the daily reality of the people providing care. What we wanted to do here at Alsico was bring that focus back to the front line, to the care workers who are dealing with that physically demanding task, the emotionally complex situations they're in, which are also very time pressured environments. We wanted to really understand what's their lived experience, because that's crucial for the research we were doing. By focusing on the everyday factors, things like physical comfort at work, the emotional support, and whether staff felt listened to, helped us start to uncover opportunities that simply organisations could realistically act on. And those improvements don't require huge structural change, but they can have a really big impact on the workers and how supported those workers feel in their role.
That's really interesting. The frontline views are really important because we've got lots of people making lots of decisions about the care workforce. And actually, sometimes they do tend to forget the individuals themselves, the lived experience of the workers. And it's really good to see that there are simple opportunities because I think we sometimes tend to overcomplicate things, keep it simple. You talked a bit about well-being there as well. We're doing some work with another research organisation around this because actually, certainly within older person's care, people coming towards the end of life, that has a huge impact on the welfare and the well-being of our staff. And they have to deal with this on a day-to-day basis. And they are largely incredibly resilient, but it does take its toll. There's lots of areas in terms of the physical demanding side, which is we often associate with providing care, but it's the well-being side, the emotional side that actually some things you can see and experience on a day-to-day basis can actually impact your personal life and draw on other experiences and traumas one's had in their own lives that can kind of surface in the work environment. So really important areas to look at. What gaps were you hoping to explore that kind of previous workforce reports might have missed? Because I know there's a lot of workforce reports out there. So what were you hoping would be different?
So for us, one of the gaps we were interested in exploring was the connection between different aspects of the working environment that don't always get looked at together, such as physical well-being, emotional resilience, career development, and even uniforms themselves can all influence how people feel about the job they do, particularly in the care sector. For example, we often talk about training or career pathways in workforce discussions, but we also want to understand the smaller everyday factors that shape job satisfaction. That includes things like whether people feel comfortable in their uniform, whether they feel able to raise concerns, or whether policies designed to support staff are actually being understood and used in practice. By looking at those practical experiences, the aim for us was to provide insights to organisations to help them understand and see if they can genuinely act on them. Things that help create a more supportive working environment for care workers and ultimately strengthen the sector as a whole.
Brilliant. I think that the physical, emotional, career side are incredibly important everyday factors. And we often forget, we've talked very much about comforts of uniforms, and I know that's an angle that you're particularly interested in as well, but the research covers a whole wide range of areas, but I didn't really realise quite how challenging it is for some care providers to do these real physical roles in really restrictive, uncomfortable uniforms.
Yeah.
So that's really important to call out. And I know we're going to start talking about some of the insights from the research, but when you looked at the research findings overall, what were the insights that really surprised you the most?
One of the biggest insights for us was just how strongly the everyday working conditions influence how supported the people do feel in their role. I know we often talk about the workforce challenges in terms of big structural issues when we look at the sector, but what came through for us was how much the daily experience of the job matters. Physical comfort, the emotional support, and access to development opportunities, they all came through as important drivers of job satisfaction. One stat that really stood out was that half of respondents said the emotional demands of the role have affected their mental health, which really highlights the emotional investment that's involved in care work.
Yeah, that's really interesting. I think the well-being side, the emotional side of the role itself is incredibly challenging. And I think we sometimes underestimate and play down the impact that must have, especially in older person's care when we know we're at the end of people's journeys.
Yeah, and I think something that we got out of it, though, is that many of the opportunities for improvement are quite practical. Things like better communication, clear support structures, or just involving those care workers in decisions about the working environment can really help make a difference to how valued and supported the workers feel.
Yeah, there's how are you today, and actually
Yeah.
listening, and that high level listening and making sure people just checking in with people when they've had a bit of a wobbly time, or they've been particularly close to someone, maybe lost someone, or it's just been a really busy day out on the floor today. How are you? How was it when we have the handovers? Was there anything that kind of really challenged the assumptions about what care workers actually need in their working environment that you came across?
Yeah, I think one of the assumptions it challenges that improving retention always requires big complex changes. And I think what our research showed is that smaller everyday factors can have a surprisingly large impact on the staff satisfaction and in turn retention. For example, we found things like training, emotional support, career prospects, and coming back to uniforms, they all ranked among the key drivers of job satisfaction. And that really reinforced that well-being at work isn't just about one single initiative. It's about how different aspects of the working environment come together. Ultimately, it highlighted that listening to staff and responding to their feedback is incredibly important. When organizations focus on improving those daily experiences, whether that's physical comfort, well-being support, or clearer career pathways, really makes a difference to how people feel about staying and building a future in the sector.
I'm a little uncomfortable by my own description of calling these smaller factors, because actually they're really significant factors, but we understate their importance, and that comes through in the findings. But for me, it's that active listening, really listening to people, what are they saying, what are they hearing, what are they feeling, making sure we talk to people and understand, because we get a lot of training that we push on to people, and we tell our staff they've got to be trained, this is the minimum standard, here's some more training we've got coming through. But actually, in addition to the training, are there any areas of training that they feel they need for themselves that would help them to do their jobs differently, or to do to better, or to improve, and to support them emotionally? I think they're really key areas. If I move just on a little bit to the physical well-being and injury side of the findings, what did the data reveal about physical strain and injury among care workers? Because that was a worry for me. It would be really great to hear your thoughts.
Yeah, so one of the clearest messages from the research was that it's far more physically demanding in the care sector than people often realise. Care workers are on their feet most of the shift. They're supporting residents with mobility, lifting, repositioning, and carrying out a lot of repetitive tasks throughout the day. And it's a role that requires both strength and stamina. And surprisingly for us, in the research, around 28% of respondents told us that they had experienced an injury at work that required time off, which really highlighted how common physical constraint can be in the sector. It showed that even when organizations are doing the right things around training, the nature of the job itself can still put a lot of pressure on the body.
I think we're saying here nearly a third of our workers have suffered some form of injury in the workplace. And I think that's very significant as a sector compared to other sectors, because it's incredibly physically demanding. And our average age of our workforce is 45 and over, which brings other issues, MSK issues and what have you, to the surface as we all age. So yeah, recognizing the physical side of things, I think is really important. But how common are our injuries in the sector, and what typically causes them? I think would be a key thing to dive into here.
Yeah, findings suggest that injuries are often linked to the cumulative physical demands of the job rather than one single incident. Care workers are regularly assisting residents with movement, helping people get in and out of bed, supporting them with walking, reposition them safely. And what seems to be that those tasks are happening more times a day, often across long shifts. So the physical strain can build up over time. That's why musculoskeletal issues and fatigue are commonly mentioned when we talk about injuries in care roles. So repetition's really a key factor, and I think that's what's alluded to throughout the research. Many of the movements involved in care work, the bending, the lifting, the reaching, supporting weight, they're repeated dozens of times in a shift, even when they're carried out safely. And that kind of repetition can still lead to strain over time. And that's why it's important to think about the whole environment that the workers are working in, not just the task the worker is doing. The way equipment is used, how tasks are structured during a shift, and even the clothing people wear while doing the job can really influence how physically demanding the role feels day to day.
And I suppose, when if you go to a gym, you warm up before you exercise and do your workout, and then you warm down afterwards. And we don't do that within care. We're straight in. We have our morning briefings, straight into the work, and we're running around, lifting, moving, repositioning, hoisting.
Yeah.
And I think, yeah, we maybe just need to think about that a little bit more to make sure our staff are suitably warmed up and supported, and making sure we have got the right equipment and it's fully serviceable and it's all in check to be able to support people where they need. And they're not dragging huge cumbersome bits of equipment from one part of the service to another, that it's accessible where it's needed. And actually, we encourage residents to be as independent as possible where we can, because that helps them maintain their strength. And we do tend to double handle lots of care within residential care. We tend to almost help people decondition, so we do everything for them. And we need to rethink some of that. We've had a couple of papers on that recently, which show that actually there is something in the fact that actually we should try and get residents to participate more, because it will slow down their rate of deconditioning. So what practical changes can help reduce physical strain for care workers?
I mean, there were many encouraging things, but one of the encouraging things from the research was that many improvements are actually quite practical and achievable. Regular refresher training, well-maintained equipment, encouraging staff to report near misses, or physical strain early can all make a difference. But it's also about designing the work environment around the people doing the job. In other sectors, we talk a lot about ergonomics, and the same thinking applies in care, whether that's accessible equipment, smarter processes, or uniforms that allow people to move comfortably and freely throughout a long shift. Ultimately, those small improvements across those areas can help to make the job more safer, more sustainable, and easier on the body over the long term.
Yeah, and I think you talked about reporting the near misses, and I think that's, you've got to create a cultural environment where people feel safe to do that as well, because some people get really nervous about, oh, I'm going to be labelled if I report this, but actually that's how we learn. We learn from that data. So with our residents, we have to report near misses, slips and trips rather than just falls. Actually, from a staff perspective, we should say, do you know what? This resident, it's a bit awkward to move them in this way, the way their bed or their furniture's positioned. What can we do about it? Because it might prevent some more serious injury. And if 28% of our staff are having injuries, we need to do something to try and reduce that, because from a health and safety perspective, that's really not good. It's not good. It's really important data. So now thinking probably a little bit more on the emotional well-being and mental health side, what sort of things did you find when looking at staff well-being and mental health more generally?
I guess one of the strongest messages from the research was just how emotionally demanding care work can be. Care workers are supporting people through some of the most vulnerable moments in their lives. And whether that's managing their illness, supporting residents with dementia, or just being there for the families of the patients or the residents during difficult times, that level of emotional involvement is incredibly meaningful, but it can also take its toll over time. And in the survey we did, half of the respondents said the emotional demands of their role had affected their own mental health, which again highlights the pressure many people in the sector are carrying. Care workers can be deeply committed to their role, but without the right support structures around them, that emotional strain can lead to fatigue or burnout.
It's that's really important around the care workers being deeply committed, because I think sometimes I know care workers and I know people who manage care services, and over the years you do see them harden slightly to certain things, and they withhold some of those emotional things, and it's a bit like a pressure cooker. At some point you have to release that. It's not healthy, and there is a huge emphasis on mental health, and I think sometimes it's a bit of an overused term in some respects. Just because we talk about mental health, it doesn't mean we've got a longer term mental health issue. But actually, some of the stuff that we experience on a day-to-day perspective within care services can draw on our own loss and trauma, and can create moments in time where actually we don't feel great about ourselves. And that is a time when we need to maybe take some time out and work on our mental health to kind of strengthen ourselves. But again, to have that safe environment to be able to talk about it and say, I'm having a bit of trouble today, and to maybe have some lighter duties or to move away from some of the more slightly traumatic work while we just regain some of that support, because burnout is a huge thing within care services. We do see about a third of our workforce leave the sector every year, and they go outside of the sector, and that's not good. And burnout comes through in many of the surveys and many of the reports that we do. So how do you feel burnout and fatigue showed up in the work for the care workforce?
I think we found that it doesn't always appear suddenly. It often builds through the combination of emotional responsibility, physical work, and busy shifts. The care workers themselves are constantly balancing compassion with professionalism whilst managing time pressures and the needs of multiple residents. Over time, that can lead to emotional fatigue where people feel drained or less able to recharge between shifts. That's why well-being in care has to be approached as an ongoing priority rather than something that's only addressed when problems arise. And I think as we've gone through the research, something that the most powerful thing for me is about voice and being able to vocalize and be listened to as the workers in those environments.
Yeah, because that costs nothing, does it?
No,
Nothing other than a bit of time to have a conversation and to check in with people. Because burnout is gradual, it almost becomes normalized because you don't
yeah.
see it. If it was a cliff edge, you would see it and say, "Ah, gosh, the shock's there. Someone's exploded. It's happened. We need to deal with it." But because it's so gradual, you don't necessarily see it, and it's building day on day. And you said something really important. It gave me a few goosebumps. Actually, was the balancing compassion and professionalism, and our workforce are absolutely highly professional in what they do. Experienced, well trained, highly experienced, very well trained professionals in what they do. And I think sometimes they lack that respect that they deserve in that case. And it must be really hard when you are challenged to retain that level of compassion. But our care workers do it on a day-to-day basis. And we shouldn't underestimate the challenge that must give them. You did allude to it, but in terms of what culture, what role does team culture and workplace support play in the reports that you've produced?
Team culture plays a huge role in how supported the people feel. The care work's very team orientated, having colleagues around them that they can talk to, share experiences with, or rely on during their difficult shift seems to all make a significant difference. Open comms is key. When staff feel comfortable, raise concerns, sharing feedback, or talking about how they're feeling, it's clear that creates a healthier and more supportive environment. In many ways, that sense of belonging and trust within the team is just as important as the formal wellbeing initiatives.
The teamwork really does come through, but so does communication. And
Yeah.
communication costs nothing. Good communication, we can all talk, but actually good, effective communication and active listening goes a really long way. And I think you're right about the feedback, but you have to create a culture and environment where people feel safe to give feedback. They feel safe to share. They're not just waiting for their shift to end to walk out the door and think, God, thank God the day's over with. They're actually comfortable to share so that change can happen. But that's culture. That's a really important point. So I don't know what came through in the findings, but what does good organisational support actually look like in practice from what you found?
So we did find some stuff. So good organisational support often starts with the leadership and the communication from that leadership. When managers were taking the time to check in with staff, recognise the work that they're doing and creating space for meaningful conversation, it was sending a powerful message that well-being matters. It can also include more structured initiatives, things like mental health, first aiders, regular wellbeing check-ins, or team discussions where people can raise challenges and share ideas. But perhaps most importantly, it's about creating a culture where the workers feel respected, they feel valued, and they feel listened to and can share their voice. I think when organizations get that balance right, combining practical support with a strong team culture, it will make a real difference to the morale, the motivation, and importantly to staff retention, not only across the sector, but for those individual employers themselves.
Yeah, and that's what's really important is we do need to impact recruitment and retention, but not to the detriment of workforce morale and motivation. So that leadership, I think a lot of it does come down to this because culture starts at leadership and cascades down through organizations. So leaders need to make sure that when they do talk about structures, initiatives, and safe environments, that they're authentic and the culture needs to be authentic. It has to start with leadership, management, and the workforce all working towards common goals and drivers and feeling safe. Another factor I think that's really important to consider is the average age of our workforce is 45, and over 79% are female. And I know the work we've done with you before, some fantastic work with menopause support and Diane Danzebrink. And there's some great resources that we've managed to pull together on our website and some videos to support people. But that was part of your report as well. And I'd really like to ask you why you felt that menopause is important and it was such an important issue for the workforce.
It's an important issue largely because the demographic, as you've referenced, of the care workforce themselves, the sector's predominantly female, as you've alluded to. Experienced care workers are in the age group, as you've identified, 45 plus. and they're either experienced menopause or perimenopausal symptoms.
I would like to just ask you about menopause and why that's such an important part of the report for the care workforce.
It's an important issue, largely because of the demographic of the care workforce themselves. The sector's predominantly female-led. Many experienced care workers are in age groups 45 plus, where they're either experienced menopause or perimenopausal symptoms. And that means it's not a niche issue. It's something that affects a significant proportion of the workforce at some point across their careers. Again, another important stat, around 28%, almost a third of women who had experienced menopause symptoms said they'd consider leaving their role because of them. And that's a really important insight. And that resonated with me because those individuals are often some of the most experienced members of the team. And if you lose that knowledge and not retaining it, it's extremely valuable for the care organisations. And to lose it is incomprehensible almost for those organisations. So making sure workplaces are supportive during that stage of life, it becomes an important part of retaining not just the skill set, but the people who provide those skill sets. The encouraging thing, though, is that many of the adjustments that help can be quite practical. Things like flexible working where possible, ensuring staff can take breaks when needed, or just simply create an environment where people feel comfortable talking about what they're experiencing. They all seem to make a big difference, but require little effort to bring those into equation.
And we've discussed menopause with the amazing Diane Danzebrink from Menopause Support, who's done work with Alsico previously. Yeah. And thank you for sponsoring that work. I know we've got 5 videos online, lots of resources for women who, also those who are not experiencing menopause, to understand menopause more. But some of those small changes that cost absolutely nothing. One of our members does menopause coffee mornings, and it just gives the staff the ability to sit down with peers who are also menopause experienced, to share some resources and to share some experiences privately in their own environment, to talk really fluidly and free. And actually what they said is that it's really helped to solve a lot of the problems with people having to take time out because of menopause, because they feel that sense of camaraderie and there's a sense of understanding. And that costs nothing to host a coffee, let people have a bit of time out their working day to sit down and discuss it with other peers. And actually they found it created efficiency within the system because less people were off as a result of it. So there's lots of simple things we can think about. And I think it's also very important that men also start to understand symptoms of menopause, what menopause is about. It's not a taboo subject. We mustn't shy away from those conversations. And when we've got males within the workforce, that they need to understand that actually some women might be challenged on a day-to-day basis. Some days they might not be, some days they might be. And there needs to be the ability for them to speak freely about their experiences. So there I'm really passionate about, and it's great that it's come through in the findings again. So just looking more generally then, so what does good support look like for organisations that want to retain their experienced staff more generally?
So good support really starts with awareness, communication. Many organisations now have menopause policies in place. We've also introduced outside of care into our own industry. But what the research shows is that awareness of those policies isn't always as strong as it could be. So I think one of the most important steps is making sure staff actually know what support is available and they feel comfortable accessing it. Manager education is also key. When line managers understand menopause, feel confident having supportive conversations, it will help remove some of the stigma and it will make it easier for staff to raise issues early. Practical adjustments can also play a role, whether that's flexibility around shifts, providing spaces where staff can cool down if needed, or considering factors like breathable uniforms that help people stay comfortable during physically demanding shifts that these care workers are going through each and every day. Ultimately, it's about recognising that supporting people through menopause is part of creating an inclusive and sustainable working environment. And when organisations take that approach, it's not only supportive of the well-being of workers, but it also helps retain the experienced professionals who are vital to the quality of care being delivered within this sector.
That the care work staff are the most valuable asset in any care organisation. Without them, you have nothing. But I agree, leadership and manager education is incredibly important, especially if the manager is not menopause experienced. They might not be or they may have had a seamlessly trouble-free menopause. But to make sure there is education at that level, I think is incredibly important because people need to feel included, and inclusion is a really important part of being within the sector. You talked about the breathable uniforms as well. And I think that's really important because I think if I go back to maybe 10 years ago, these horrible materials that didn't give, they didn't stretch, they created a lot of kind of heat retention. And it must be really challenging for people working in the summer when sometimes we've even got heating on in the summer in really hot environments. If you put menopause symptoms on top of that, where someone might be flushing, that's only one of the symptoms. But, uniforms more generally, in terms of workplace design and uniforms, they matter more than people realize. What are your thoughts on that, and how did your research highlight the role that uniforms and the workplace can play?
It's interesting because uniforms can be seen as quite a small detail, but when you look at the day-to-day reality of care work, what people wear for an entire shift, it really matters to them. Care workers are moving constantly, as we've discussed throughout this. So the uniform needs to allow for mobility, flexibility, and comfort. Our research documents show that 58% of care workers said the fit of their uniform affects how well they can carry out their duties. That's a really high percentage. It really highlights for us that link between clothing and performance. If something doesn't fit properly, restricts the movement, or makes people feel too hot during a long shift, it will add to fatigue and physical strain. But uniforms also play an important role in areas like temperature regulation, infection control, and the overall professionalism of the role. They help maintain hygiene standards, but they also help staff feel confident and identifiable in their role. So when uniforms are thoughtfully designed, they're actually supporting both the well-being of the workforce and the quality of the care being delivered.
There's some great stats we pulled out today around 58% of the workforce talking around the fit of the uniform impacts the role. And we also talked about the 28% who considered leaving their roles because of the environment and going through their experience of menopause specifically. And 28% also had suffered injury as part of their role. So there's some really important reasons here why we need to start to look at uniforms and support more generally for our workforce. What difference does it make when staff do feel comfortable and supported in their working environments, though? Did the report shine light on that aspect?
Yeah, I think when people feel physically comfortable and supported at work, it has a real impact on how they experience their job. If a care worker can move freely, stay comfortably throughout a long shift, and feel confident in what they're wearing, it removes a lot of the small frustrations that can build up during the day. Those small improvements might seem simple, but they can contribute to a much more positive working environment overall. When organizations listen to the staff feedback, they can make adjustments that improve daily comfort. It will send a really strong message that well-being of the workers matters. And ultimately, that contributes to a higher morale, stronger team engagement, and as we've mentioned before, better retention for the sector and for the employers. And in a sector like care, where experienced and motivated staff are absolutely essential, those improvements will make a really meaningful difference.
Yeah, and it's the listening that's really going to drive the motivation. So listening, making those small changes that make a big difference, really impacting motivation, higher morale, higher engagement. So if we just look at turning that insight into action, if you were advising a care provider listening or watching this conversation today, where would you suggest they start?
I think a good starting point is just simply doing that, listening to the people doing the job every day. Talk to your care workers, understand the challenges of their environment better than anyone. Create regular opportunities for feedback, whether that's through team discussions, surveys, or informal conversations. You'll reveal a lot of practical improvements that might otherwise be overlooked without doing such things. The research showed us that many of the factors influencing staff satisfaction are actually quite everyday things. It could be reviewing how equipment is used in the home, making small adjustments to the working environment, improving communication between managers and teams, or just looking at how uniforms and workspaces support the physical demands of the job that the care workers are doing. Often the most effective improvements come from organisations creating a culture where staff feel comfortable raising ideas and concerns. And when those people feel listened to and involved in decisions that affect their working day, can have a really big impact on the engagement and morale of your workforce across the entire organisation.
Listening, as we've said, feedback on everyday things, small adjustments, improving communication, making sure the physical environment is appropriate. These are all kind of just small things that can really have a very big impact and make people feel very involved. So they're the simple things that we can do. But longer term, looking maybe over the next sort of 6 to 12 months, what practical steps could organisations take in that regard to go that little step further?
Yeah, I think if we look mid to long term, 6 to 12 months, there are a number of relatively achievable steps that organisations could focus on. One, review the everyday working environment, look at things like equipment, workflows, and uniforms. Make sure they're genuinely supporting staff who are doing the care work rather than adding to physical strain. Another important step is strengthening communication and wellbeing support. That might involve regular wellbeing check-ins, encouraging open conversations about challenges, or just making sure staff are aware of existing policies and resources available to them. I guess finally, organisations can look at how they involve staff in decisions, get feedback from the staff, get their voice into the decision matrix. And whether it's trialing new uniforms, reviewing training approaches, or exploring workplace adjustments, bring frontline teams into those conversations. That can lead to solutions that are both practical and widely supported. And as I've said previously, we've gone through this. Many of these steps don't require major investment. They're about creating a culture of listening, responding to feedback, and making thoughtful adjustments that help care workers feel supported in the work they do every day.
We talked about the short-term, immediate things we can do, which cost little or nothing, and then just taking that into the slightly longer term, looking at maybe the equipment where there's a bit of capex involved, the redesign of uniforms, breathable, stretchable, not adding to the physical strain, really embedding that culture of open communication, because culture takes time to bed in, it doesn't happen overnight, and making policies accessible and capturing the voice of care providers and acting on that voice, I think, is really important. So they're the things that I've taken away from what you said there. But again, and if we look forward, how can the sector really build on your research to create better workplaces for care professionals?
I think it comes back to what we were just talking about. It's about listening. So the key for me is continue to listen to your workforce, turn those insights into actions. Research like this that we've done just helps shine a light on the everyday realities of the job. But the real value comes when the organisations in the sector themselves can use the insight to shape how they support the teams going forward. One important area is collaboration. Providers, suppliers, and sector organisations all have a role to play in improving the working environment for the care workers themselves. When the providers are working closely with partners, whether that's around training, workplace design, or uniforms that the workers are wearing, it will create opportunities to develop solutions that are genuinely built around the needs of the frontline staff. And I think there's also value in continuing to explore workforce experience through research. The sector is continually evolving, whether that be through technology, demographics. All the expectations keep changing over time. And if you keep a regular pulse on how care workers are experiencing their roles, that will help organisations to stay responsive, make improvements that will really reflect the real-time world changes or challenges that are being faced. Ultimately, many of the opportunities identified in this research, though, are about practical innovations, small but meaningful changes that will really improve how the people doing the daily working tasks experience their work every day. And when the sector continues to focus on those improvements, it will help create workplaces where care professionals feel supported, valued, and able to build long-term careers.
Yeah. I think there's a couple of surveys recently that talk about actually career progression is a very important factor for care workers, and it's often overlooked in many organisations. It certainly doesn't exist in many jobs that are advertised. They don't talk about career progression, and it's one of the reasons why people don't apply for jobs. But the genuine,
and I think that links into retention as well. If they haven't got the career progression, I need to look outside the sector, and we're both aware health and social care sectors have very high attrition rate with staff and low retention rates. And little things like that, if there's career progression, that will aid the retention aspect within the sector also.
and the genuine support for frontline staff, it needs to be authentic, I think, really does come through. And you're absolutely right to talk about the continual research. We need to do more research in the sector. We've been a bit shy of research. There's some organisations do lots of fantastic research, but there's many organisations that do absolutely none at all. And I know the Care Quality Commission is really favoured and looking for care providers to get more involved in research, because from research, positive things happen, change occurs, and the sector evolves. And we've been a bit slow in parts of the sector to embrace research. That's a really good point to call out. And thank you very much for doing the research that you've done. You talked about technology, and if I go back 10, 15 years, technology was in its infancy in adult social care. Now it's all about technology, and we're really playing catch up because there's been a big shift. And we have to remember, some of the generations, my generation, we didn't grow up with technology. So we're not always comfortable with it as well. So we need to make sure people keep checking in with us, making sure we're comfortable with it, because it's big steps for some of us.
And from uniforms as well, if you look at technology, yes, technology improvements in the construction of uniforms and the fabric we're using, but also we need to design uniforms to accommodate technology, such as iPads or mobile phones these days, or electronic equipment that are being used by care workers. They need to be able to store them while they're doing the job, and we need to accommodate those within uniforms.
You're absolutely right, because years ago it was just a pen. that you literally had a pen and a watch maybe was on your uniform, but now you need pockets to cover things, or gels and things you need to carry, gloves that you might need to carry. So it's a really good point. Look, Greg, thank you very much for joining us today and for kind of sharing the insights from the report. I think what's really clear from this conversation is that supporting the care workforce isn't just about big policy debates that we often hear about. It's also about the everyday experience of working in care, from physical comfort and injury prevention to emotional well-being, and also workplace culture and opportunities for development and career progression. The research definitely highlights that many organisations across the sector are already doing some excellent work. I think that came through, that there is good evidence in this space, but it also shows there are practical steps providers can take to strengthen that support for their teams and improve retention and morale. Many of the improvements that support care workers cost very little or absolutely nothing at all. Comfort and injury prevention are often overlooked in workforce conversations. We need to make sure we create those environments to be able to allow those to happen in a safe space and in a safe way that people feel comfortable to be able to share it, because we will learn from that and we will reduce them over time. And that's what's really important. Retention is not about pay. It is about pay, but not just about pay. It's about people, how they experience their work every day, and that we need to make sure that we're supporting care workers properly to improve the quality of care that they're providing so they can be at their best all of the time. And these are really compelling reasons why care providers do need to review the reports that you produce and act upon some of the findings, because they cost little to nothing. And if there is a cost, there's a huge benefit and a return on investment for doing so. So if you'd like to explore this research in more detail or hear any more from the discussions around these findings that we've talked about today, we will also be hosting a webinar very shortly. The details will be in the notes below, with Professor Martin Green, OBE, that's Care England's CEO, and our colleagues from Alsico who conducted the report, to look more at what the data tells us and how providers can turn that insight into action. So look, a huge thank you to everyone today who've been watching or listening. We look forward to continuing the conversation with you and how we support the people who deliver care across our sector. Please do read the reports. We'll make sure that links are available in the notes below. Please also do connect with our webinar and subscribe to that so you can experience Martin Green's views directly. So thank you very much, Greg, and we look forward to seeing you again soon. Bye for now.
Thank you.